Hi, I'm Dr. Jurgens, and today we'll be talking about diabetes in pets. Now, diabetes is something we see pretty commonly in animals in all sorts of species, dogs, cats, even ferrets or small mammals, and it typically presents in middle-aged to older animals. In talking about diabetes, it's essentially a disease of insulin, and insulin is a hormone that's produced by the pancreas, and it's what helps regulate your body's blood sugar. And essentially, it's what helps bring that sugar from the bloodstream into the cells so your body can use that sugar for energy. In diabetes, we have a problem in how they are able to use the insulin. And so in people, we really talk about type 1 or type 2 diabetes. We don't really have those distinctions in animals, but we can kind of characterize it similarly, but dependent on species. In dogs, it's more similar to type 1 diabetes in people, meaning their pancreas isn't able to produce insulin like it should. Cats, on the other hand, are more similar to type 2 diabetics, meaning they can produce some insulin, but the body just isn't able to respond to it as well, so they're more insulin resistant. So depending on the species, essentially what we have is this lack of response to insulin, and so the sugar in the bloodstream becomes really, really high. A normal blood sugar in an animal should be between 100 and 120 usually, and in diabetics, the sugar can get upwards of 300, 400, even 500 or higher. But even though there's all this sugar in the blood, the cells can't actually take that in to use it for energy. And so the cells essentially start starving. And so that leads to one of the really commonly seen signs in diabetics. They'll have a really ravenous appetite, but they'll still lose weight, even in previously overweight animals. Other signs we might see in diabetics would include increased thirst and increased urinations as well. Those are kind of the classic signs we might see. So if we're suspicious of diabetes, we can pretty easily diagnose that with blood or urine tests. And if diabetes is diagnosed, then we'll need to start your pet on treatment, which consists of daily insulin injections. This is something that owners can learn to do at home. It's a very small needle, so even though that can be intimidating, pets usually tolerate it really, really well, and it becomes part of the routine. There's a couple different insulin types you might hear of. In dogs, we tend to use more brands like Veterinary or Novolin insulins. In cats, you might hear of Lantus or Glargine used a little bit more commonly, but it really just depends on the individual animal. So once we start treatment with our insulin injections, it's very, very important to do frequent monitoring of our patients, especially in the first couple weeks after we start treatment. And this is so that, number one, we don't have our insulin or our blood sugar running too high, but equally as important as that is we don't want to overdose with our insulin and have our blood sugar drop too low. So that can actually be really, really dangerous. It can lead to symptoms like weakness. They can become disoriented or even have seizures or die if their blood sugar is too low for too long. And so very, very important that we don't give too much insulin and that your animal eats a really good meal with each insulin injection morning and night. And there's a couple different ways we can monitor to make sure we're at a good insulin dose. You might hear of us checking a blood spot glucose, meaning you bring your pet into the clinic, we take a blood sample, and we just check a blood sugar usually about 6 hours after the previous insulin dose. Another thing we might do is a glucose curve, meaning you drop your pet off at the clinic and we'll check a couple different blood sugar samples throughout the day to get a really good sense of how our sugar is rising and falling over about a 12-hour period. Some owners do decide to learn how to monitor at home as well, which is something that is doable. There is a little bit of a learning curve to learn how to draw blood on a pet. It's not as easy as a little finger stick in a person. And you do have to have a special glucometer, one that is calibrated to measure for animals rather than people, but that is something that some people do with success. So once we find a good insulin dose for your pet, then our good news is we expect a very good quality of life, and they can actually have a very normal lifespan. Diabetics are a little more predisposed to certain other diseases. We think of things like infections, so skin infections, urinary tract infections. We also think of things like pancreatitis. And then in dogs, we actually expect all dogs with diabetes to develop cataracts, which will eventually cause them to lose their vision, which sounds scary, but they usually adapt to that really, really well. And there is actually a lens replacement surgery that's available for pets that qualify for that. Now, there are a couple things that owners can do at home to help get your pet at the lowest possible dose that will control their symptoms. Really, really important is actually keeping them at a nice lean body weight. Overweight animals are actually more resistant to insulin, so they'd actually need a higher insulin dose than an animal of the same size that it's a nice, healthy, lean body weight. So very important to keep a nice, healthy body size and to avoid being overweight. Diet's also really important in these guys as well. We most of all say it's important to be consistent. So feeding the same thing morning and night with each insulin dose, trying to minimize snacks in between, and especially trying to minimize carbohydrates. In dogs, diets high in fiber are a little more important, and there are actually prescription diets available for both dogs and cats with diabetes, and we might recommend that depending on your pet's individual nutritional needs. Also important for diabetics to try to minimize their insulin dose would be regular blood work to screen for any other disease processes. Something that's pretty common is if a pet develops another disease, whether that be something as simple as a urinary tract infection or something more serious like liver or kidney disease, that will actually make them more insulin resistant. And so in a previously well-controlled diabetic, you might notice their insulin dose kind of creeping up on us and them requiring more and more insulin, and that might signal us that it's time to do some blood work or urine tests just to screen for any other disease processes that might be hindering that maintenance. So I hope this has been an informative talk on diabetes. If you have any questions or are concerned that your pet might be showing signs of diabetes, make sure to schedule an appointment with your veterinarian.